Many people involved in the civil commitment process, from family members to doctors, to behavioral health workers to police and judges, say the state standards for forced mental health care need to be reviewed.
Civil commitment laws haven't changed significantly since they were written in the 70s. The needs have changed. Treatment options have changed. Treatment programs have changed.
Kathy Shumate leads a team of investigators in Multnomah County. She says civil commitment should be a last resort, but it may be time for everyone to ask, is the bar where it should be?
This is such an important law and such an important process that impacts people's lives so significantly that I think to let it sit idle in the statutes doesn't serve us well. It doesn't serve our community well, and I don't think it serves people who are living with mental illness well.
Our KGW investigation found about 90% of people taken to a Multnomah County hospital on a forced mental health hold were released within 5 days, before a judge could rule on any civil commitment. Many of these people may have agreed to treatment, but thousands of people were released because they didn't meet state standards, even though police officers or behavioral health workers said their apparent mental illness symptoms were dangerous to themselves or others. Understanding that the bar is that high to protect the civil liberties of the individual, is it at the same time possible that the status of that bar being high could lead to an individual not receiving either recommended care or the care that they would need?
It does. They may be discharged from a treatment setting without the length or level of treatment that's recommended, and they leave that place continuing to experience significant symptoms of their illness.
Judges have written that high standards could be an issue, preventing some people from getting help before they end up in jail. Portland Police Lieutenant Chris Burley says officers feel frustrated, perpetuating a cycle of taking someone to a hospital for mental health treatment, only to later find them in crisis again.
I do think as a community we need to come together and say, as a state, are we comfortable with where it's at right now?
Burley says people with severe mental illness can be released because their illness stabilizes in the hospital, only to deteriorate again on their own.
But I think it is telling, like, they got a bed, they got meals, they have a roof over their head.
Treatment.
Some treatment. For some folks, that's what they need. So why would we stop providing that?
But Casey Lewis with Disability Rights Oregon says not so fast. He admits there are gaps in the civil commitment system, but says focusing on the law is misguided.
So I think rather than looking at the standard for civil commitment, really the thing that would make the biggest difference for people with mental illness and for the community would be to say, how do we keep people from ever getting to that point?
Lewis says the bar is high to protect individual rights, and so few people are civilly committed because mental health workers rightfully encourage any other option first, like voluntary treatment. Instead, Lewis says we need to do a better job of caring for people when they're released from a mental health hold.
We need to be having more resources available in the community, more placements for people who maybe need wraparound services, who need more supportive housing, who need medication management, things like that.
What can we do if the individual's buy-in isn't there, if it's not voluntarily something that they will accept or seek out?
9 times out of 10, if you are able to sort of spend more time with a person with mental illness, really understand what they need, there are ways to connect them with those resources, even if they are initially reluctant. You can build that trust, and you can build the relationship that it really takes to do that.
For Brenda Gardner, fixing this cycle for people with severe mental illness is personal. She and her husband spent years trying to find help for their son Eric, who experienced violent thoughts and delusions. Housing was a major problem. As a parent, would you have hoped for something like civil commitment for stability of medication or something like that?
Yes, if there was a decent facility available. He's functional enough. If he had a little bit of support in, a supported housing, I think he could manage.
She says the entire community suffers for failing to help people with serious mental illness symptoms, pointing out an overlap with the homeless crisis and, at times, drug addiction and crime. Eric Gardner is now homeless in Seattle. Sometimes his parents have been able to visit him, but they wish there was more they could do.
The problem is that the laws were changed so that their civil rights are what is all important, and their safety is not.